One question I get a lot is, let's say I don't sleep that well. Should I exercise? Well, the short answer is yes, provided that it was just one night of poor sleep. In fact, there are studies showing that if you're slightly sleep deprived, meaning one night's poor sleep, so most people need somewhere between 6 and 9 hours of sleep, varies by person, varies by age, varies by time of year, and so on, all discussed in that series with Matt Walker. Most people need 6 to 9 hours, but let's say you normally get 8 or you normally get 7, but you're down 2 hours on sleep for whatever reason. Should you exercise the next morning? The short answer is yes, provided it was just one night of poor sleep. It turns out that exercising after a poor night's sleep can help offset some of the negative effects of sleep deprivation on what? On brain performance and health. Now, you don't want to get into a habit of this. You don't want to get into a habit of using exercise as a way to compensate for sleep loss. So if you don't sleep well for one night, exercise is a great way to offset that sleep loss effect on the brain, or that would otherwise affect the brain. You can compensate for it by doing some exercise. Keep in mind, you want to exercise in a way that's not too intense, because you can drive your immune system down and be more vulnerable to infections. That's certainly the case after a poor night's sleep. You also want to be really careful with what you do for that exercise in terms of your coordinated movement. It's much easier to get injured when you're sleep deprived. In fact, there's a really nice set of studies, Layne Norton's talked about this elsewhere, that the relationship between sleep, or I should say sleep deprivation and injury, is a strong one. And the relationship between sleep loss and pain and failure to recover from injury is also a strong one. The direct point being, if you're slightly sleep deprived, sure, go ahead and exercise. That will actually help you offset some of the negative effects of that sleep deprivation. But you want to be careful how you exercise so you don't get sick and you don't get injured. So you can keep in mind that if you're having trouble sleeping, or even if you're a great sleeper already, getting exercise will further improve the architecture of your sleep. In fact, there's some evidence that doing high-intensity interval training can improve the amount of deep, slow-wave sleep that you get. And there's some additional data showing that if you do high-intensity training early in the day, and that's combined with a bunch of other things that stimulate autonomic arousal. So here we are again at autonomic arousal. Things like caffeine, if that's in your program, you don't have to drink caffeine. Things like getting bright light in your eyes early in the day, definitely do that. Don't stare at the sun or any light so bright that it's dangerous or painful to look at, but certainly get bright light in your eyes. All those things that increase autonomic arousal early in the day can also help improve the amount and the quality of sleep that you get at night, in particular, rapid eye movement sleep, which is so critical for learning and memory.